Hi, my name is Dr. Brett Payne and welcome to Main Street Chiropractic. Today we're going to be talking about the 10 most common questions asked to your chiropractor. The first question that we're going to be talking about today is that what techniques do you use in your practice? Now the correct way to answer this question is it depends on what's wrong with you. Some chiropractors are only efficient in just one technique. And the problem with this is that not every condition that chiropractic care can help with can be resolved with just one technique. Sometimes we need to change these kind of things up. So you need to know that there are many wonderful different techniques that we can offer here. For example, I've been trained in over 10 different techniques, and these techniques are specifically designed to help you reach your goals and achieve successfulness in healthcare. So I have many natural ways of relieving the patient's pain and restore their optimum range of motion, flexibility, and ultimately their function. The second question we're going to be talking about today is, do you take x-rays when necessary? It's important to seek out a chiropractor or a back pain specialist that does take x-rays to rule out any kind of serious problems. Caring for a patient without x-rays is kind of like flying in the dark without a radar. It just doesn't make sense. You want to be able to fully educate the patient as well. And it's kind of challenging to be able to fully explain everything to a patient just in words. So sometimes I like to use x-rays to be able to educate, in addition to ruling out, like we said before, those serious health problems. Now sometimes we're able to figure out these health problems that could be serious potentially from the health history and the examination. But sometimes it just works best to make sure by doing the x-rays. If the chiropractor or the back pain specialist you're consulting doesn't take x-rays before recommending treatment, you should consider talking to another doctor that does. Now the next question that we're going to go over is, will you give me your recommendations in writing? This is very important because this allows you to go home and to think about it. And it also gives you an explanation up front of the care that it will consist of, how long it's going to take, and ultimately how much it's going to cost. The next question that we're going to go over is, can you furnish me with references? This is an important question. You should try and get about 5 different references. 3 of those references should come from present patients. The other 2 references should come from other healthcare professionals, such as orthopedic doctors and medical doctors. These references are important because it gives you a window of opportunity here to figure out how the regular patient's care is going right now, how they feel like their care is on an ongoing basis. And the other 2 references from the other healthcare professionals are important to find out what other healthcare professionals feel how your treatment is doing, because they're referring their patients to you as well. So it's very, very important that they know exactly how you're treating the patients. Feel free to call all the references that you receive. Many people get references and they don't even use them. Call all 5 people. You can never be too sure about a person, so definitely do the homework. See what kind of person you're going to be getting treatment from. You'll be glad you did. The next question we're going to be going over is, do you have payment plans available? And any successful chiropractor is going to have payment plans available. Now I see both cash and insurance patients. And what I like to do is give you a payment plan option that breaks it down into low monthly installments. This really causes the stress of the financial side to be put at ease. Any successful practice is always going to be able to work with you, whether you're covered by insurance or not. The next question that we're going to be going over is, will you guarantee my satisfaction? You should receive a 100% guarantee of unconditional satisfaction. But by law, no chiropractor or back pain specialist doctor can guarantee results. But for example, an office that offers the following guarantee, you'll be totally satisfied with each office visit, or that visit is free. That shows that they're putting their money where their mouth is. And in my office, every patient knows if they feel rushed or don't get the care and attention that they deserve, then that visit is free to them. And in the 5 years that we've had that policy, every single patient has been very pleased and very satisfied with the kind of care and the quality of care that I provide for them. I always look at things as quality over quantity. I always want to give each and every patient the time that they deserve, and I like to respect that. So make sure that the doctor you choose is willing to stand behind their care. The next question we're going to be going over is, do you have a no waiting policy? A recent patient survey revealed that the most irritating thing to a patient was that a doctor's office didn't respect their time. And at our office, we really try to focus on that. We want your experience from the moment you walk in to the moment that you leave to be a great one. So we always try to be very, very respectful of your time, and we book an appointment that's specifically for you, with giving you no longer than a 5-minute wait period in our office. And that's our guarantee. The next question we're going to be going over is, do you have a criteria for determining how many visits I need? Now, each and every patient is looked at as an individual, case-by-case basis. And what we're always looking for and determining is, by your examination and by your x-rays and your health goals. And we combine all those different things to come together to get your success in what you're wanting to attain here. Some patients want to just get out of pain, and some patients actually want to gain correction. So what we do is we monitor the patient each and every day very, very closely. We put you on a conservative course of care, and within about 12 visits to 30 days, whichever comes first, we will do a reevaluation, which will consist of evaluating the tests that were positive in the exam, and then we'll follow up with another set of x-rays. And then at that point, we'll do an additional report of findings where we'll go over your first set of x-rays and your findings from your examination and compare them to the second examination along with the second set of x-rays, and monitor your progress, and then we'll adjust your treatment plan accordingly. The next question we're going to be going over is, will you show me ways of preventing what you're treating? Now, what we do here at my office is, once we complete the report of findings, we go over a treatment plan. Some of the treatment plans will consist of some at-home exercises that you'll be doing for the first couple of weeks. Then once we get some joint stability in there, then we're going to do a little bit more advanced bit of home health care. And what we'll be doing is each one of the phases, there will be 4 phases total. Each phase will be 2 weeks long, and they will all be catered specifically to your needs to help you achieve your goals in the office. The next and last and final question that we're going to be going over today is, do you offer free consultations? Yes, we do. Here at my office, we are always offering free consultations because I think it's vitally important, because it's kind of like an interview. You need to get the opportunity to talk one-on-one with the doctor, and you need to also meet the staff and check out the location. You need to make sure that this is a good fit for you, because you're going to be visiting us somewhat frequently in the beginning, and you need to make sure that our personalities match, and also I, the doctor, meet your needs. So we do offer always a free consultation so you can make sure that this is the right fit for you. Thank you for watching this video. We hope you found it informative and educational. You can also follow us on Facebook, Twitter, LinkedIn, YouTube, and on our blog. We are centrally located in the Mid-Cities area and just 5 minutes west of the DFW airport. Catch us on the next video.